Now, the state of public health in the Northwest doesn't seem to be improving. A monitoring effort led by the Treatment Action Campaign has revealed that over 25% of people had left or knew someone who had left a facility without the medication that they needed between April and May 2022. The report identifies challenges that discourage people from going to the clinic for HIV, TB and other health services. For more details, I'm now joined by TAC's Campaign General Secretary, Anele Yawa. Anele, good morning. Good to speak to you. Now, just give us a rundown of key highlights from this study you've just carried out.
Good morning to you, Hugo, and the viewers at home. So some of the key things which came out of the report, it's around. There are some improvements on stock out, but stock out still persists because about 398 cases of stock outs of medicines and medical supply were reported in 57 facilities that we are monitoring. But also around waiting time, it has improved, but it remains long. It has improved from 5 hours, 9 minutes after a clinic has been opened to 4 hours, 8 minutes after a clinic has been opened. But also, there is also a marginal improvement around staffing. If we compare from last year, there was a reported cases of staff shortages, and this year we're finding them sitting at around 15%, as well as around index testing. The way it is implemented, it is not safe, and also people are not given options to refuse. When about 36% of people that we have interviewed have mentioned that they were not given an option to refuse to do index testing or not. But also about 34% of them are saying when they were interviewed for index testing, they were not asked whether they are involved in violent relationships or not. But also the other thing that we have picked up is that majority of clinics have improved in terms of cleanliness, except for those few that are still having some problems in terms of toilets. But also the good thing that we have picked up is that majority of facilities in Northwest have a PrEP, even though there is a low uptake in terms of taking a PrEP. But also the other good thing is that money. Yes.
Sorry, allow me to come in there. Now, you've talked about stock out. And what is the impact of stock out, particularly when you look at individuals that have conditions such as TB and HIV? What does that do to the treatment and certainly to the health of those patients?
It therefore means if there is a persistent stock out or shortage of medicines, it therefore one means that people won't be in a position to get sufficient treatment.
Hello?
And if then they run short out of the treatment, they will default on treatment. So that's what it means.
Now, you've obviously worked on an ideal standard. Now, we talk about 4 hours waiting period. What is the ideal waiting time for patients when they go to a clinic?
I won't pretend to be a scientist with regards to that, but all what we're calling for is that if people can be categorized when they go to clinics, because what you will find out is that people who are coming for appointments to see a doctor or a nurse or check up or to collect medicines, or number of cases, they queue on the same line. But also, when they get into the pharmacy, you find out that their medication is not prepared. So if we can address those issues, I'm sure many people who are going to clinics to pick up medicines might not struggle from not getting medicines. But also the other thing that might improve is to say those people who are stable on their treatment, they can be decanted to external pickup points, where they will go to these external pickup points just to collect their medication and go home instead of spending more than 4 hours just waiting for medicines at a health facility.
Anele Yawa is the TAC General Secretary, and he was speaking to us on the state of health in the Northwest. Thank you for your time this morning.